make sure we get it recorded. So yeah, thank you everybody for coming along today. If I just mention before I pass over to Dean how this meeting's kind of come about since I joined Stay in January this year, and having used the PSIAMS system before and seen what good work and impact it's had across Dudley and the wider region of the West Midlands with other organisations that are using it. And also with taking note of some of the priorities for the voluntary sector from reading an event that happened with the Chief Officers Group, the COG group here in October last year, and how a common assessment tool and a unified approach to measuring impact is so high on the agenda for the voluntary sector. I thought it'd be important to bring people together really, so we can identify how we could better manage our data and those cost savings and the social impact that we all know we make, but also to improve efficiencies across the sector as well. So I'll pass over to Dean, like I said, and then we'll pass over to Kate and James. So over to you. Hi, Sheriff.
Thanks, Terry. One of the reasons I'm involved is I am pleased to be championing the initiative, and that's very much because it appeals to my professional business consultancy role, which is what I do in the real world, as well as the role of High Sheriff of Shropshire. I think we'd all agree that undoubtedly there's going to be more service users in the system following COVID, and with probably greater and more complex needs. So I think very much a joined up approach seems to make sense going forward, the whole better together and all that type of thing. And I think collaborated and integrated seem to be the two buzzwords, and the creation of very much more a effective and efficient system, so that firstly the service users are served better and not duplicated or replicated in any way, but also that then it would mean that service providers could have better customer management, better data recording, and also better outcome monitoring, and that would be county-wide. So we haven't got the great Shropshire/Telford-and-Wrekin divide. I think the other thing that's been noticeable to me during my first 6 months as High Sheriff is that not all service providers know about all service providers. And so I see very much that this system could also help from that point of view. So irrespective of where you are in the geographical county, somebody will know who you are and what to do with you to give you most effective help. So that's why I'm keen to be involved and to support in any way I can. So thank you.
Thank you very much. So if I can pass over to Kate, Deputy Chief Officer for Dudley CBS.
Thanks, Terry. So yeah, nice to see you all, and it's nice to be able to share with you some of the work we've been doing at Dudley CBS over a number of years. I've worked for Dudley CBS for a long time. I've recently, fairly recently, been sort of the manager of our two social prescribing services that have been going for the last kind of 7 years. And I've been involved in the PSIAMS system since it sort of started, really. I wanted to give you just a bit of background information about how it initially started and how it got off the ground, and just a bit about how it's benefited our social prescribing service as well. So a number of years ago, it's probably going about 8 years ago now, we started to have conversations with our local CCG, Dudley CCG, about the voluntary sector kind of as a whole is very diverse and vast in our borough, very similar to probably what it is in Telford as well, and across Shropshire. What we were finding was some organisations were still quite paper-based with the way that they collected information and the way that they stored their information. Other organisations was using things like Excel as kind of ways to record their data, and others did have systems of their own. But there was no sort of joined up approach in the way that information was kind of being shared, or looking at the people that people were supporting, and are they collaborating with other organisations to kind of do a bit more of a holistic, person-centred approach to interventions and support. And Similarly, organisations, I guess, were struggling with their data management, particularly in terms of kind of security, kind of customer service sort of management. So we started to have conversations with the CCG about how it would be great to have kind of one system that voluntary and community sector organisations use, where it would be almost be a kind of a beneficial service on all sorts of levels. So one is as a system for front-facing staff, so where they can effectively log information, they can use their system as kind of marketing and promotional kind of services, kind of looking at tracking trends and gaps and the benefits and outcomes and impact that their interventions are making. So also for things like performance management of their kind of customers or clients and of staff. But then the level above that is more about what impact is the voluntary and community sector having as a whole. Where's the sort of the strategic information? So, for example, if you picked one example of a service area, like tackling isolation and loneliness, there's sort of thrown out there a lot, isn't around the voluntary sector plays a huge significant role in reducing isolation, but where's the evidence to support that in terms of the impact that that's having across the voluntary sector as a whole? So we were commissioned by Dudley CCG to look at developing a customer relationship management system. Hence, that's when it was kind of born, really, to kind of help inform kind of commissioners as well in terms of monitoring the delivery and outcomes and impact that the organisations that they commission are achieving. So we've got a number of organisations in our area that use PSIAMS. There's a number of organisations outside of our borough that have started to use PSIAMS, particularly across the Black Country. But we developed with the PSIAMS team like part of a platform within PSIAMS for our social prescribing service. And we've been using that since we started to deliver that project. And it's been a really helpful system because it's great for staff because they can track referrals, where referrals are coming from, what interventions are they providing. We've got the outcomes tools that are built in there, so then it can analyse the data around distance travelled with those outcomes. And then we've been able to pull off kind of reports in terms of trends, you know, where the referrals coming from in terms of geographically across the borough, what are the sort of the genders, what are the sort of from the BAME communities, what are some of the trends in terms of, are we having a bigger impact on some outcomes in terms of, say, mental health, but less so in areas like sexual health, or why is that? So it's really helped us to not only use that data and pull out reports to report to our commissioners, but also some of the cost avoidance figures and the real difference that is making, and also making some internal referrals on the system to other organisations that are using it. We've developed the system and built on it as we've gone along. So we've got verified data tools in there, the things that we've also built in around PAM, the patient activation measures, care plans. So it's a really good system to safely and securely log all of the information and the interventions that we've been doing as a social prescribing team. So it's been hugely beneficial for us. We find it quite simple to use, straightforward, and as managers it's great because you can just click buttons and pull off reports and use that data to send reports off and have those discussions. So yeah, so it's been it's really great, and it's developing all the time and looking at other apps and different tools and techniques and software that it can use to add value. There's one that we were looking at in terms of, James, it's got a heat map, isn't it? So in terms of isolation, you could see where the pockets of isolation are across the borough and then track movement in terms of kind of colour codes on a map. So it's quite creative and innovative about in terms of what it can actually do. So that's kind of enough from me, just a little bit about my background and how I've been involved in PSIAMS. I think James is going to do a demo just so you can kind of see what the system actually looks like and its capabilities.
Thanks, Kate.
Can I just ask, are you doing questions as you go along, or are you going to save them up till the end?
I think James is going to do his demo, isn't he, Terry? And then we were going to have a discussion afterwards, because you might come up with more questions when you see the system.
Yeah.
Is that okay?
I'm happy to take questions if you want to make notes in the chat. You know, that's fine as well, because that will be, you know, save you. It'll be there for everybody to see, and yeah. James.
Okay, cheers, thanks. Okay, I'm just going to share my screen with you all now. Hopefully you should be able to see that all okay.
Yep.
Let me just stop this as well, just so we Okay, so I'm going to give you a little bit of a demonstration today on what PSIAMS looks like, some of its capabilities. I've pulled a few of our solutions out of around about 300 solutions that we've created over the years. PSIAMS is built on a platform called Salesforce, which is the #1 CRM in the world. There's a lot of massive companies that use this, so Nike, Unilever, and there are some charities on here like UNICEF, and there's quite a lot of different areas of non-profit that use Salesforce. In this instance, I'm in the Dudley system, so our multi-tenanted, multi-organisation system. The data that you're going to see today is all going to be fake data. It's something that I've just put together just for the demo today. The only bit of information that's going to be real information, real data, is going to be in our reports and dashboard section, but that's all been anonymised. There's no worries about any of that. It's just mainly around some figures, just so you can get a bit of a taste and understanding of what the reporting feature looks like within the system. As soon as you log into the system, you are greeted with this page here. This is the home page. So this is the first page where everyone sort of enters onto the system for. This is our sort of leaping point into the rest of the system. The page itself is split up into two main areas. You've got the navigation bar at the top, this white section here. Now this section follows you throughout the entire system, so it makes it really, really easy to navigate the system. And if you ever get lost, there's something that you can always get back to. And then underneath is the actual page information. So on this page here, we have our home information. All of this can be completely changed around. You can have a lot of different things, but for this purpose, for the demo, I have added a report here. So this is just based on users that have logged into the system today. You can see that we've got a lot of different organisations from our Dudley system in here. If I can just refresh that, it might change the numbers around. Yeah, the numbers have gone up a little bit. So again, really live, active data reporting instantly. Underneath there, you have recent records. Now, this is really useful for if you're, say, all the way down in other areas of the system, but you need to get back to something really quickly. Your recent records will just pop up on the home page right there for you as well, which is really quick and really easy. In this demonstration as well, I've also connected our Office 365 email and calendar things. So I can see that today I've got that meeting booked in today. I've put it in as all day, as you can see from there. You can click on that and it'll give you some more information as well. And then underneath there, we've got tasks. So tasks are something that happens throughout the system. You can have them pretty much anywhere. In this demonstration, I've got them linked to inquiries. So if anybody called up to make an inquiry and I was the lead person to deal with that sort of request, I could be attached to that inquiry and it would sit here and look a little bit similar to these sorts of things that are coming through, like the support tickets that I have here. And I can click on that and it will take me straight to that inquiry so I can deal with that. And I haven't got to wait for a post-it note or an email. Everything sits within the system. To the right-hand side, we have something that we call Chatter. It might look quite familiar to a lot of people. It does look a little Facebooky group, Twitter group looking, and that's really, really helpful for organisations in our multi-tenanted systems, because you can set up your own groups where you can have your own staff, but you can also add in that collaboration and that communication with other organisations by setting up different groups where you can have conversations about certain things as well. So you can have that all built in here. This is most recent. Again, like we do have a full Chatter system that you can look at as well, which is a part of this, but I did that into the demo today. So that's the home page. On the navigation page, well, the navigation section, sorry, at the very top you have a search bar. Now this search bar is pretty much like a Google search. You can search for pretty much anything that's within the system. And what it will do is it will return back some options. So what I'm going to do is I'm just going to type testing. It should bring me back some service users. There we go. So we have some registrations here, and then from there you can just click on there and it will take you straight to that record. So really nice and easy, really simple to use. To the right hand side, you've got some more information about yourself. So you can add in an about you. So you can sort of have the, if somebody searches for you within the system, you can have some more information about you, some contact information. This is where you can also change your passwords to the system and a few other system only functions as well. So that's where that's all stored there. To the left-hand side of that, you have a notification bell. Again, very, very similar to how notifications work in your social media platform. So if I was linked to a task, it would bring all the tasks here. So we can see that information there as well. You can also favourite things as well. So you can say, well, I like attendances, I'm going to favourite that. So there's a few other little features there. So today I'm going to run you through these tabs that I have open here. When we look at tabs, we see it more at PSIAMS like how you'd have a ring binder or a folder of that person, and then those are the individual tabs around those people. So we sort of see it in that sort of a navigation style. There are little ease of use sections here as well. So you have a little drop down so you can see your most recent things, you can see different lists, or you can make a new inquiry like that. But what I'll do is I'll have a click into inquiries. What happens here is you're greeted with a list view of set parameters. So for in this example, I've got demo, the PSIAMS demo one. So these are ones I've just created. Again, you can have a list of most recent, you can have a list of all, you can have a C ones for your group only. There's quite a lot of things you can do as you can change what is viewed here with different settings menus. You can do other little things as well around filtering and charts and doing inline editing on here as well. But for this purpose, what I'm going to do is I'm just going to click on one of our old inquiries here. So the inquiry page is pretty much like we sort of see it as a that sort of stage one, that potential first interaction with somebody looking for information about services. It could be even as a portal to onboard themselves onto your service as well. So there's quite a lot of information here. I'll just run through it pretty quickly because we've got quite a lot of information on here. But if I go into the edit page, so some information that we collect is pretty generic, so things that you would expect. So the date and time of the inquiry, the name of the inquirer as well. There is things like statuses as well, so you can sort of attribute flags and different items to a person depending on your organisational needs. We've got what they're inquiring about, again, just a bit of a taste of a list of potential services or other things that you may offer as an organisation. Marketing information, so if you want to be a part of a mailing group or a list or retain some other information there. We can also have referrer information as well, as opposed to sort of dedicated referrals tab that I'll go through in a moment. It's built into the inquiry section. So if somebody was calling up from another organisation, making a referral into service about a person, you can capture their information there. You can also get the information from their organisation as well. For this, I'll just put in my organisation here. But what you can do is, if it's a new organisation that you've never interacted with before, very quickly, you can just open up this new section here where you can create a brand new organisation. You haven't obviously got to fill all of this in. You might just have a name at this point, and you can put that information in there, and then that can be saved. And then what happens is it will link together. So we just pretend I've just created PSIAMS Limited there, and then that's linked that organisation with this inquiry, which is really, really good for things like when we come to the end of maybe reporting stages, so whether it be quarterly or yearly, so you can start to see, well, actually, what organisations are interacting with us, and then try and get some more of a clearer figure, some more numbers there, because most of these things are usually captured on post-it notes or little emails, and it's very difficult to collate all of that information around who's interacting with us. So it's really, really quick and easy. And then underneath, as a follow-on with the referrer information, we have the referralee information here as well, so we can capture their name, their gender, so basic sort of demographics here as well, along with postcode and address, and maybe some other information about contacting. And what you can do from there is you can migrate that into either a referral or into a registration page, so then that opens up the rest of the system to that particular person. But if not, we do have referral elements where you can put in some notes around that, services that have been asked about as well. And then underneath you have, when I was sort of talking on the home page a little bit earlier, you have the staff assignment section. So here, if somebody centrally takes a phone call you can attribute the correct member of staff to that ticket, and then what happens is it will send them a task through the system, and that can be an email as well to alert them that they've got a new task and that they need to have a look at this inquiry to deal with, for example. And you can do other things here as well. So in this example, we've got some outcomes here. So you can really start at the very start of the system. You can start to collate some information about outcomes, because potentially it could be you've given some information, you're referring them on, they were not successful as they didn't really meet criteria of your organisation, and that's still keeping all of that information. So it's still very relevant, but really, really helpful when it comes to reporting. So that is inquiries. You can also do additional things with inquiries as well. So, oh, sorry about that. You can add notes and attachments on here as well. So you can upload files. So notes and attachments can be found anywhere in the system. So if you've got a piece of, if you've got a documentation that you've had to get them to sign, for example, you can upload those into the system as well. So it really safely and securely keeps that, so you haven't got to keep the paper copy. And then you can also do follow-ups. You can do some signposting within inquiries as well. So that's just a really quick look at inquiries. I'm going to move on to referrals. And with referrals, again, very similar to how inquiries looks when you first open it. You'll have a list of referrals that you've either interacted with or based on a set of criteria. So really simple, but it also keeps that sort of, it unifies it all together. So when you see this, you know where you are. So I'm going to open up a new referral. So when I open up a new referral, you can see that we've got some indications here. We can make quite a lot of different indications. Now this is based up here. This is based on some information here around, let me just see if I can just go and grab it. There we go, need to double up. So if it's around going to see that person, we can attribute different things. So whatever's selected in the system, we can create a sort of tagging system. So really, really quickly and easily flags to that user to say, well, actually, if you're going to see this person, you need to have a look at this, and then you can go into more detail. I'll just go into the edit screen so you can see a little bit more information. So with referrals, we can capture the date of the referral, we can get its activity sort of status as well, whether it's active. We can have things like pending, and you can start to do waiting lists and loads of different things like that as well. We can add those systems in. We've got again the referral details, so we've got some information here. We've got the referral's address, referral contact information, so all really good stuff that you would get from a referral. We can add it all in, and this is completely custom. And then we've got some further information here about the referrer, so you can capture that information as well. Again, if it's from a GP, for example, we can link in the GP surgery and the actual GP as well, because you can store surgeries and GPs within the system as well. So all that information is really, really relevant. Again, some risk information as well, and then some miscellaneous sections that you might want to add some extra detail in as well. So we've got some of those sections here as well. And that's referral. And what you can do is you can then convert this referral into a registration, which really opens up the rest of the system. And I'll go into registrations in a minute. But with referrals as well, we can do a lot of other things as well, where traditionally users would have to enter this information in by hand, so typing it in. So very similar to probably processes that you have now. But we've also enabled recently the ability to link things like referral forms and different types of forms onto WordPress websites. So if you have a WordPress website, we can build in forms in there, and then that can transport all of that information without having to input it again straight into the system. So again, some really good time-saving techniques we've added into the system as well. There is also, again, we've got notes and attachments. So if we're adding additional things, you can even attach the original referral document as well if you want to. So there's loads of different options that you can do with that as well. You can also do a printable document, so a printable view from this as well, and it'll automatically pull all that information in for you to print off. So there's a few little additional things there. Oh, sorry, I'm really dry. So, and that is referrals. Registrations. So registrations for us is the core record of a person. So this will contain all of their demographic information, all of their equality information as well, and loads of other little bits of information as well, which I'll go through now. We'll open up John Test Worthington here. With registrations, again, it's that the look of the system is like turning pages in a book that we like to think. So everything on the left-hand side is the page you're on, and then all the things to the right-hand side is the next page. So you can always know that you're sort of walking in the same direction. So if you're going this way, you're going forward, or if you're coming backwards, you're going back through to the original record. So again, helps. It sort of subliminally helps users navigate the system a lot easier as well. So with details that we capture on the registration, we've got quite a lot on this demo one here, just to give you a bit of an idea and a bit of a flavour for what we can do. So at the very top, we have GDPR compliance. So this is something that we've created in collaboration really across a lot of the organisations that use these PSIAMS, not just in Dudley, but from our other sites around the country as well. Something that was really robust for everyone, and that covered everything that they needed to have. But also gave them that sort of ease of use, because we understand as well that the GDPR was quite a hard-hitting thing for a lot of people to get their heads around. So this really helps and sort of leads a little bit more for organisations as well. So the first field here, we have the compulsory consent for the service user that you're going to put onto the system. We have two main consent types: in-person consent and remote consent. So in-person consent is pretty much a written signature about okaying service to deliver to that particular person. We have different breakdowns as well. So we have a full share, so they're okay with you sharing all of their information with the relevant people that they need to. We have limited as well. So limited, I'm okay with a few things, but I don't really want you to share some other things. So you can sort of discuss a little bit more about what's okay and what's not. And then we've got a no share at all. So I don't want to share any sort of information with any other third party that you may work with. So you can start to track that really easy as well. And then we can link that back to reports as well. And I can talk a little bit about the research section down here in a minute. So following from that, we have the consent of staff. Now this is an organisation field, and this will link to a couple of different things. So we have a legitimate interest, a public interest, legal interest. So for example, if somebody with the consent said no share, you may have a legal interest, for example, that might need to override that. So it could be some sort of a safeguarding issue that you may need to alert some people to, so information does have to be passed along, so you can sort of add those elements in there as well. There's also marketing consents with this as well, because you can't just add in, are you okay for marketing now? You have to be a little bit more explicit with what does that mean. So we've got a lot of options here. So photos with and without name, promotional videos, videos in general, websites, the social media aspects as well that we can add in as to this as well. So again, you can capture all that information. Information for clients as well. So if you have to send some information out to the client, what is the format that they want that in as well? So again, very easy, really quick things you can do. In these multiple select boxes, you can just do that, or you can hold control and move them over. So really quick and easy things for people to use. In our drop-down menus as well, very easy and very standard, which will help a lot of organisations, especially around when they're trying to capture key bits of information. That they don't want 50 different ways of being able to spell one particular ethnicity or not. You can really lock it down. So it really helps when it comes to reporting time. Research consent. Now, research consent, we can link that back to your reports as well. So if somebody says, no, I don't need to do any research on me, we can link that through there as well. So you can sort of set that as a field parameter as well on the report, so they wouldn't come through. And then one of our really key features for GDPR is last interaction date. Last interaction date is a field with date and time. And what can happen is you can either update this yourself, or we can add in a couple of processes to do it for you. And what it will do is every time that you've entered something new with this person, that date and time can be updated. So That can then help with reports around your data retention policies. Now, every organisation can be different, and we can change that for however many, whether it be in a single system or a multi-tenanted system. Every organisation has a different view that you can see here. So we can change different parameters there. And what that can do is then, if we say it comes to the end of your 2-year retention policy, if this record would show up because it was back in 2016. So then that will then help and then lead you to sort of be able to interact with your data a lot easier and take the appropriate steps, obviously remaining compliant and making sure that that person is either in service still or you might need to remove it. And if it does come to that stage where actually this record does need to go, you can flag it for deletion, and then that can go to your administrators or centrally as a group of organisations where then that file can be deleted. And then underneath there, we go straight into the nicer information that isn't GDPR. So you've got their name, you've got their address, we've got things like known as well, so you can record information like that. Middle names, you've got genders as well. We've got date of birth, and then automatically that will then work out what their age is as well. And that's a rolling that is a rolling counter as well. So when it comes around to their birthday, it goes up and down. So you'll always have a live sort of look about how old your clients are, especially if you produce reports where it's around age ranges of people as well. You always know that's always completely up to date. The address information. So with address information, it's powered by Google. So you can type in a postcode, for example. You can start typing in part of an address. So I could type in Stafford Street. So, oh, there we go. Well, I can spell Stafford Street today. I'm just, so it's Stafford Street, and it will come back with some options. I know it's Dudley here. And then what happens is it will fill all of that information in. So then it can sort of help if you only got like a couple of bits of information. If you know the postcode, for example, and maybe the number of the house, you can sort of go that direction as well. Then we have contact information, so loads of really like useful bits of information, even like some extra little fields, so preferred time of contact. So some people can only be contacted between certain times, so you can add that information there. And then underneath there, we have equality information. So the information that you can see here is a mix of data that has been sort of brought together from the big lottery and European guidelines around sort of categorization of data. So again, but if you follow different processes, we can change around for that. That's completely fine. So we have a lot of different options here. We even have like education levels. We have disabilities, learning disabilities, employment status as well. And then underneath there, we have emergency contact information. For this demo, I've put 2 on here, so you can make sure you've got that information straight away. And then there's also additional information, so you can catch NI number and NHS number if you need those bits of information. And if you need any other little bits of information as well, we've probably got a field for it as well. So that's how the registration looks. And then if we look to the right-hand side with things that we can sort of do with this client. So again, you can start to see the picture that's sort of unfolding really for this particular service user. So we've got a few one-to-one sessions. We have some WebWebs as well, referral form support plans, risk assessments, and then we have groups that they attend and their attendances as well for that group. And then we can see where they've exited service and potentially come back as well. So again, it's all that mindset of everything's in one place for one person, and you can definitely search for a person and then just decide to go, I want to go and create a new WebWebs this way, or you can just go to the very top like we do here and then just go from there. But I'll just carry on through with to this way with WebWebs. So some of you may use WebWebs, you may be aware of it, but it's a standardized tool. We can incorporate standardized tools. We do have a few of them in here. So we have, I think we have ParQ, Core. There's a few. We have a few more around counselling, because we do have a few organisations that have a lot of counselling. So we do have those tools. But again, if we can, most of the time we can put the tools in as providing that obviously around copyright and obviously the usage of that, but we can import them in. But with WebWebs, what we've been able to do is traditionally, when people create WebWebs, They have to then do a manual calculation afterwards to work out what the score is. But we've sort of taken that off you within the system. So the calculations and all the scores are done in the background for you automatically. So it removes that human error. So if I edit the WebWebs here, so you can see that we've got a date here as well. So you can see when it was done. We can select a type of WebWebs. So this is something that we've added in more so rather than the WebWebs form itself. Now this will help with reporting when you want to sort of do that progressional movement of looking at a service user. So when they came into service, what was their score? And then when you can do multiple ones in midterm as well. So you can sort of gain a bit more of a stepped process of looking at that. And again, with the post one as well. So you can sort of bring that all together through reports and sort of see the either individually or as an organisation as a whole, where we sort of, are we helping or sort of adding that sort of value in as well with that development of someone. Then underneath, you can see the WebWebs tool itself. We have the questions here. And again, these, if you used it before, the options look probably really familiar to you. So we can do it from there. And then we can just change a couple of these around. And then what happens is once you click save, it will then change the score again. And then we've just got a live score here. So it'll do it automatically. So it really helps with those sorts of situations when it comes to sort of removing that sort of additional administration process that, that does take a little bit of time. Following from that, we have our one-to-ones. So one-to-ones are pretty much any sort of interaction that you may have with a service user or client. So it's a really good way of making sure that you get every interaction that you do into the system, and then you can really start to build that out, because there's a lot of organisations that were doing a lot of one-to-ones but never recording it, and it was really difficult at the end of years when it's just trying to work out, well, actually, how many hours did we really spend? But with little tools, little quick sections like this, it doesn't take very long to do it, but it brings a lot more added value as well to services with these features. So what we do is we capture the start date and time and the end date and time, and then what we do from there is we can work out the duration of time for support. So you can start to calculate that, and the system will just do this in the background, and you haven't got to worry about it. And with reports, you can see at the end of the year you've done so many thousand hours in one-to-one support, so you can really get that really key bit of information. So a lot of organisations are not generally sort of funded on the one-to-one aspect, but it sort of adds with added value. So if they're going for other projects and talking about their added value, you can sort of add that information in really quickly. So we categorize these as well in a few different ways. So we have support type. So we have appointments, and then we have inbound and outbound, and then those are split down into calls, emails, letters, text, visits. So in reports, strategically looking at your entire organisation, you can see, well, actually, is there a lot of proactive from clients? Are they coming to us, or is it a lot of reactive where we go into them? And then you can start to obviously look at capacity planning, and there's a lot of different things that opens up by one field, and just how and just the importance of just really sort of saying what was that interaction type. And then underneath we have support given. So this again, just a bit of a list to give you some idea of what can be captured, but befriending, emotional support, well-being, even job searches and other things. So you can add information in there. You can add notes in as well. So you can get so you've got a lot of the quantitative things here, but you've also got a lot of qualitative as well. So you get the real key bits of information for organisations as well. You can you can flag a one-to-one as well. So you can sort of say, well, actually, this didn't go too well, so I want to just flag this to other staff. And then what happens is this will then sit on the record with a little flag, which you can then sort of, it's more of a visual notification for people. So if they work with this person as well, it might be actually, I might need to have a look at that. So we've got some key identifying information as well being captured there. Then you have some more around the supporting notes and maybe the key worker notes as well. So actually, this is what John thought was happening today, and then you can go into a little bit more depth, so you get both sides as well, which is really important. And then underneath, you can add this section to most areas of the system. So you've got the support rating, so you can sort of get from that person, well, actually, what did you think of the session today? How was it today? So you can attribute that as a wording scale there. And then that will then link to stars, and then a lot of organisations use that as part of their end of year reports, or maybe even to put on their website. So it gives a sort of rolling sort of idea on how the service is going and what service users think of the service. So that's one-to-one. We have support plans as well. There's quite a few different ones that we have, but for this demo, I've done a bit of a generic one. So in the support plan itself, we can see the date of the support plan. We can see if there's any funding. So if there's any funds that come through, either it being private or it's from a different funding source, for example, that can all be tracked as well. Referring body, so where was that person coming from? Around who helps me, so you can capture that information as well, so you know where that is. And then you've got the agreement of sharing plans, because it might be that you need something a little bit more in depth that you may be talking with a GP with, so you need to say, well, actually, are you okay with this? So you can capture those information as well. You've got some caring sections. We've got personal reflection, personal goals and aspirations as well, which is really important for the growth and progression of service users as well. It gives you those key attributes there as well. And then we've got some other sections around the summary of support that you receive as well, so you can start to see some more information. What's really good with these boxes is as well, you can actually just move them about as well, so you can sort of extend them a little bit, so it makes it easier to view them as well, which makes things a little bit easier. Underneath, we can sort of track, well, actually, what is your timetable like for that? So you can say, well, this is the days and times that I'm available. And then you've got things like budgeting as well, so who manages your budget, and then different things like that. So there's a lot of different options really with support plans, but again, we can build quite a lot of that to fit everyone's needs as well, so we can change that. But what also happens is as well, if you create a new one of these, it will then put it in the old one into history. So you've always got that running and roaming sort of history about that person for their lifetime that they're in the service, so you can always keep that. Risk assessment. Risk assessment is an amalgamation of, I think it's two different council risk assessments and a CCG risk assessment as well, sort of amalgamated that to make sure we've got a really good, robust capturing of risk assessment. So within the risk assessment, we have an overview page, what we call overview. So we can capture the date of the assessment, if you're going to flag it from here as well. And then there's different things like key safes as well. So if you enter properties as well on behalf of, if they can't get to the door and so on, you've got that information here as well. We've got a pre-list checklist. So you can put in some extra information here. So if you need to check anything, make sure that's all done. Then we have the categories themselves. We have harm to self, harm to others or from others, activities, physical health, mental health, some other sections here. And this is just really just to give somebody at a glance that may be new to working with that person, a really quick overview of that person's risks. But if you need to go into more detail, you can create individual risks, so you can really highlight certain areas. So in this instance, we've flagged it as well. Say there's some risk from the home environment. You can put notes in here, but we also have a ranking list for risk as well. So this is pretty generic. This is something that we've put together as PSIAMS, and a lot of organisations use this as a scaling process now. So it will go anywhere from a no risk to a high intense and likely risk. So you can really get down to the really nitty gritty of how this risk can affect. So you can really narrow it down. But what you can also do is as well, you can record some notes on mitigation as well, and how you then reduce that risk after mitigation, because a lot of organisations can use that to say, well, actually, there's quite a lot of things with this particular service user when they entered, but we sort of help mitigate quite a lot of that, and obviously reduce the risks, obviously to themselves or others. So again, some additional impact has been made with that person. So you can capture all of that information as well. Attendances. Now, attendances are what we use for group activity, and it's really, really simple to use. With groups, you can add your attendances here. So we can just add in more people via here, and then it will link and search for people that are registered onto the system. We can do it so it's anonymous as well. So there are a couple of different options for that as well. But there are a lot more benefits to having using somebody that's actually registered in the system, which I can show you as we go through the process. So with the attendance section itself, we can say we can give it a name. So we can give the group its name. We can say when it started. Are there any group outcomes that we're trying to achieve? And then obviously we've got the section here, which is around we've closed a group down, for example, but most groups may be rolling, so that can keep going. You can upload files here as well, which is really useful. So you can put in some key material for that group as well. So you can upload sort of what we're doing from week to week. And then so if another member of staff picks it up, they can just see what's going on. We have sessions as well. So you can start to record every session that happens of that group as well. And then the attendances of the people that are in there as well. So we've got some people that are registered. So what I'm going to do is I'm going to create a new attendance. So I'm going to say it is today. We'll just leave this blank for the moment. And when I click save, what it will do is it will automatically pull all of the people that are registered. So if you have 100 people registered for a group, it brings it all back into this session. What you can do from there is you can do a print attendance list as well. So you haven't got to then go and try and create a list of attendance. The system will do it for you as well, so you can print that off. We can configure this a little bit differently as well, so we can put some different things in. So we can, and then we can change how that works. So you've got some more information. And then what you can do is you can register the attendance for everyone all in one place as well. So you haven't got to go into each individual person's record and update all of this information. You can do it all here. You hit save, and it will then go and update all of the records going backwards. You can also put notes in for the session as well, so you can sort of highlight key people if you need to. And what happens is, if I go click back onto John Tess Worthington and then scroll down, we can see that he's a part of, the group, the demo group, and his attendances here as well. So you can start to really get that. And then what we can do is we can link the attendance to groups to update the original last interaction date as well. So you're always getting that up-to-date information coming through, and the system will take care of quite a lot of that sort of legwork for you as well. So it sort of removes that human element as well of forgetting to do certain things. So it really helps when it comes around to reporting, and maybe even just checking in with certain people as well to just see if they're still going to groups and if they're okay. So that's attendances. The last one I'm going to go through is exits. Now, exits, we sort of see this as an end point of capping of a particular session. So if you work a lot on referrals, we add a section onto referrals, which is around the exit. So you can get the start date of when they referred in and when the time that they left. So then you can start to work out then actually how long on average are people staying within service with us, and sort of tracking those bits of information as well, because a lot of organisations can then use that for capacity planning, which is really good, because when you can look at the previous year and say, well, actually we had a spike around October, November, December time, you know that then you may have to look at that. But we were quieter in other months as well. So it sort of really does help with that, those sort of internal bits as well, as an organisational structure. So that is the some of the data entry points for the system. So what I'm going to do is now, I'm going to look at the reporting section now. So if I open up reports, so I've got some demo reports here. So I've got users logged in today. I've got one-to-one cost savings, and I'll go through a little bit how that works in a minute. We've got the total service users by their gender and ethnicity. So you can really break down some of the equality information, but again, you can do this with loads of different fields as well. We have the total hours spent with clients. So when we're talking back to that duration of time as well, so we can sort of see how much time are we spending with our clients. And then we have a when webs report as well. So the when webs report will break down when we're talking about the type. So it was whether it was a pre, a midterm one, or a post. So you can sort of see that progressional movement as an overarching number throughout the system. So if I open up the users logged in today, so this is one of the more simple reports that we can do. So this is just around people logging in. So as an organisation, you can see how many people have logged in today. You can even do this by department as well if you really want to go into that. So you can see individual as organisations as well. But as anyone who's sort of controlling the sort of multi-tenanted aspect as well, you can sort of feedback that way as well, where you can see lots of different groups as well. But this just gives you a bit of an idea. What's really good with the reporting system as well is once you've built the framework, it's there. You can change fields, you can change date and time, for example. So if you had a quarterly report, you haven't got to keep building the quarterly report. All you have to do is just change the dates and change the times that you need it for. And that data is then brought back to you instantly. So when you sort of lead up for quarterly and annual reports, it may take a few weeks to get everything ready. But once all these have been done, really, most organisations can get it done within a couple of days now, as opposed to a few weeks, which helps put you know, sort of removes that sort of burden that a lot of people get around reporting times and trying to find all the data and making sure it's all okay. So, but what you can do as well is you can change the chart properties as well. So, for example, there's loads of different types of charts that we can use here. We've got donuts, we've got the line graphs as well. But in this case, it won't return because of how the data's formatted. And again, with those ones as well, we'll leave it back on. We'll leave it back on the donut one because it's really easy. But what we can do is as well, we can change some of these metrics and how it works as well. So we can combine the smaller groups into others if we want to, or we can just untick that. We can show the percentages as well for the organisations really quickly. So we'll do things like that. And then what we can do is we can just change like the legends. So there's a couple of different ways of viewing how we do charts and how that information is portrayed. So that's users logged in. The really nice one, cost savings. This might take a while to load because I think it's checking over 15. I think it's 1,500 records. No, actually, it might be a lot more than that. I think it's about 15. It could be 15,000 actually. So what I'll do is while that runs, I'll just open up a different report. So we'll open the total service users. So these are all the service users that were created in the last financial year. So obviously we've got quite a large number here. And then what we've done is we've broke that down by gender, but then we've done a further breakdown by ethnicity as well. So we can really start to get those key bits of information now. So you can start to see, well, actually, from our services, who are actually interacting with us the most by gender. And then we can also see what are their ethnicities as well. And you can do that with loads of different areas of the system and loads of different fields as well. So just by getting this bit of information, it's only using 2 fields. So you're getting quite a lot of data. And as you can probably imagine from the registration page itself, you can start to really get some quick data that you can just change on the fly, because you can just go straight into the edit page here as well. And then once that's in there, we can just go, well, actually, I want to see the service user age as well. So I can have a look for service user age, click it, adds it on, and then we can save and run. And it's just as quick as that, and it will bring it back. And so you can really make some quick modifications to this, and you can start to see all this is cumulative as well. So not really an average, but you can set this so it's the average age as well. So you can do like loads of different things in there as well. So see, oh, there we go. So this is the cost savings one. So when we were looking at one-to-ones earlier, when we was looking at durations, now from a user point of view, you wouldn't see this in the background, but the system is doing this automatically from calculations and costs that were given to us by one of the organisations. So they wanted to see via one-to-ones how much it would cost for a GP to deliver this one-to-one, how much would it cost for a nurse, and then we know how much it costs as a voluntary sector, how much that costs per hour. And then we've got voluntary as well, because obviously there's a give back in money if it's a volunteer doing one-to-ones, but they just wanted to just see what the volunteer one looks like. And it really is showing, and it's quite telling really, just looking at this straight away. So we can change any number of these. So if we know how much it costs for a support worker that's statutory, we can say, well, that's how much they cost an hour, and then we can do some cost savings around there. But you can really start to see just a figure of knowing how much that it is per hour. We can see the difference. So going from all of these figures here, we can see that this is the voluntary sector cost here, and then obviously the volunteer cost, and then obviously that can draw it back. So there is quite a lot of information that we can do with cost savings, and a lot of it can be done really quickly in the background. And then reports like this are really good for tendering processes and going back to commissions and just saying this is how much added value that we're actually bringing into the community. And that's just in one-to-one. So we can do this in a load of different areas as well, but it just gives you a bit of an idea as well. So you can sort of see this. I've done it in a month as well, so we can get all of that information. So if you really want to see a lot of information, you can do with the system. Or if you just want to just nice simple reports with some bits along the top here with some key information here, it's just really quick. It's really simple to do. So that's the one-to-one. That's one-to-one cost savings one. Underneath that, we have the total number of hours spent with clients. So again, this is for all organisations that was using one-to-one last financial year. So we can sort of see the peaks of where support was. There was a lot more one-to-one support there. We can see there's sort of the dips as well in different times of the year. So again, really, really good that you can get a total for this. So you know how many hours you've spent, how many records you've created as well, because that could be important as well. But it also gives you that trend as well to sort of say, well, actually, based on last year, we know we're going to be really busy in July. So we might want to see about how we sort of go about doing some of other projects, or it might be that we might need to look at maybe capacity building potentially. But again, the longer you use the system, the more you can sort of look at this, and you can start to look in yearly as well, and you can see that progression maybe even in a quarterly view as well. So you can do loads of different things there as well. So the WhenWebs report. So the WhenWebs is based on all of the ones that we've just out of the system. But what we can see is on this particular report is I've run the averages first. So this is the averages between the pre, the midterm and the post. So we can see that there is a slight increase there from the pre one to the mid, but there's a really big jump by post. So you can sort of see that from the sort of when they come in to when they leave, they're making really big strides in their progression and their development. And then what I've done is on the second one here, which is the highest WhenWeb score. So you can sort of see, well, you had a 70 there, the highest one was a 37 there, and then the 70 at the end. So it could be that if this was one particular record that sort of flagged this, or it could be a few of them, that something, you know, there was really good to start with their WhenWeb score, but something happened in between and then they got back again. So again, there's quite a lot of thinking that you can do around this, and obviously it's quite subjective because the data is going to be a little bit because of how it's been entered and where I'm searching from. But it really gives a bit of an understanding then from all areas, and this is like from a lot of different WhenWebs records. And then we've got the smallest WhenWebs as well, so you can sort of then see the gap between the people that are scoring the highest and the lowest. Is quite a vast score, but again with the mid it's not that far, but again it's quite easy to do a lot of things like this, and we can turn the details on, we can turn them off, and it's just really just a simple way of just getting report data that's really, really clean and easy to understand. So that's the reporting tool. What I'm going to do is now is I'm going to show you the dashboard. So dashboards are really, really useful bits of information. So these are very similar to the reports that you've just seen. A couple of them, I've done the chart a little bit differently as well, but a lot of organisations use these when they go into meetings, so whether it be with commissioners, whether it's boards, meetings, or it could just be as a strategic look to all the rest of the staff to sort of see, well, actually, where are we at as an organisation? And you can create loads of these. I could just keep adding more reports going down. But for this demo, I've just pulled off the reports that we've used. But in that one page, we can really see a lot of information that's really clear, and so you can really just run to that as well. So what I'll do is I'm going to hit refresh now, but this will probably break because it's going to wait for this report, but you'll be able to see other areas as well. It's because this will take a bit of time to come in. But you can see that from users logged in today, it was in the red, but now we've sort of gone into the here as well, because in this particular format of chart, we can set what is red, what is amber, what is green. So if you have a set of figures to say, well, actually, we need to have 150 referrals every month, we can run a report on that and say, well, actually, where are you at now? Where are you at today? How close are you to your goal of getting the figures that you need? And again, really, really quick, but it will also, because it's live and instant, you can then take the necessary steps. So if you're in red and you're you know, you've only got like a week or two left before the end of the month and you're in red, it can sort of instantly sort of drive in the, okay, we need to focus on referrals at the moment. So loads of key bits of information. The cost savings one come back in as well. So I've changed the chart for this one. So we've done it over the final quarter I'm actually, did I do the final? Yes, but I've done it backwards. So over the final quarter, so we can sort of see by the voluntary sector cost, and then we've got the nursing cost as well, just as the demonstration for this, just to have a quick look. But again, different charts, you get a different perspective. And then when we was looking at the total hours spent, we could see loads of different records, but in here, we've just opted for the number, just so we can just see an amount. And those are just really, really just great pieces of snippets of information, really, without having to see the entire report. And then underneath, with this particular report, I've changed it around for the gender by ethnicity, so you can really see, so you can see all of the ethnicities here, but you can really see, because of it being a larger screen as well, you can see that breakdown, and you can really start to see all of that breakdown as well a little bit easier. And when you highlight out, when you sort of scroll over them as well, it gives you that information, so you can see gender, and then you can see the ethnicity, and then you can even see the count, and then the percentage. So it's 6.68% of the 1,500 people that are sort of defined as the gender as female are Pakistani. So it's really, really useful. That's going to be it for the demo. So thank you very much for letting me show you PSIAMS. Hopefully that was really helpful, gave you a bit of an insight to how the system works and how it looks. And I think I'm passing back to Terry, I think now. You're muted, Terry. You're doing a me, you're muted.
Hi. Apologies. So yeah, thanks James for that really enthusiastic overview of the system. It's more enthusiastic than me actually. So yeah, I mean, as you can see, it's quite, I mean, it is a bit mind-boggling, the amount of different fields and tabs and the way you can configure the system to meet the individual needs of the organisation is really, yeah, quite dynamic. So yeah, I mean, over to you guys really for any thoughts, feelings, questions that you might have about the system. What do you think? What do you think, guys? Has anybody got any questions?
I have, Terry, as you'd expect. What's the cost situation on this?
Oh, straight cut to the chase there.
Accountant, sorry.
The commissioners waited at least 20 minutes before they asked that question. So, correct me if I'm wrong, James, but so from what James had mentioned earlier, for quite a small singular system for one organisation, it could be between £5,000 and £7,000. And then for a larger organisation such as Stay with around 15 to 20 users, you're talking about between £12,000 to £15,000, depending on the size of the build and how many different things need being built into that. Post the initial build, then you have your licence fee each year. So Salesforce have £70 a year per user for each registration, each licensee, and then there's £100 on top, which covers for the support from PSIAMS. So, you know, if I want to call James and go, I really need a report to show me this, and this, or, you know, or how do I get rid of this? Or, you know, the support kind of, you send a support ticket over to James, or, well, and his team, and then they support us back. I think that's right. Is that right, James?
Yeah, Terry could work for us with that. That was
I
amazing.
think I am.
And I guess it does depend on, it depends on what Telford and across Shropshire are looking to do. So the conversation with commissioners this morning was, do they want to kind of pilot it with a set number of groups who work with, say, alcohol, drug abuse and mental health? So is it going to be something that the local authority and the CCG pay for, and then expect a certain number of groups to use that one system as a kind of joint commissioning reporting tool? Then that would be slightly different. But if it's individual volunteers want to use it as their own a person-centred design system for their own organisations, then that would be a cost to those individual organisations. So it depends on what the plans are and the vision is for your area.
And did you have Telford and Wrekin and Shropshire there this morning? The commissioners from both.
The CCG, yeah, we had the CCG, which is Telford.
Oh, right, okay.
Yeah, it's one CCG now, isn't it?
Yeah.
So was that Julian Povey? Sorry, Terry, it's Wendy Faulkner. Hello. Was that Julian Povey who attended today?
No, so from the CCG today, we had Craig Lovett, who is their governance chap. We had Stacey.
Don't worry.
Mental health commissioner.
Okay.
And we had some individuals from the local authority. We had Rob Montgomery, who's their GDPR go-to person, as well as some individuals from public health, Lynn Stepanian, and we had Saskia as well from the CCG.
Okay.
But you didn't actually have anybody from Shropshire Council?
Didn't get anyone over from Shropshire Council, unfortunately, after sending out, unfortunately.
Okay. Terry, I find this very interesting. We have actually already got this package in place, but it's Salesforce, and we went live about 4 weeks ago. It's not through PSIAMS, but it's through the Homeless Link.
Inform?
Yeah, Inform Community. So we've done it through them. Yeah. Now, I would be interested, though, in sharing information across areas. So it's whether or not our package could actually be, somehow we could share information. Sorry, Terry, go on.
Can they speak to each other? Is that what you're trying? Is that kind of?
Yeah, because they are the same platform, aren't they? They're Salesforce, very similar systems. Mm-hmm. So it's whether or not they could communicate, but we could probably make an internal referral to yourselves, perhaps. I don't know. It's maybe we sort of look at that, really.
I think in terms of systems talking to one another, I do think it is possible, but again, we'd have to look at the extent of what that possibility is, because we build things in quite a different way to a lot of other organisations that build Salesforce instances, and sort of how we design a lot of things as well. But we can definitely look at that. We know it is possible, though.
Yeah, thank you.
Yeah.
Any other questions? Oh, Deb's reaching. Oh, and
yep. Yes, I reached across. I wondered, we use volunteers to provide support for the service users that we come into contact with. So could you differentiate on this this system between who was a service user and who was a volunteer, so we didn't need to use two systems?
Yeah, so for a couple of the organisations that we've built systems for, in the registration page, we can create what we call a record type. So in your instance, it would be service user, volunteer, business contacts. We've even done GPs, because we can do HR as well. We can put staff members on there as well. So there's loads of different ways we can categorise different types of users of the system or people that are going to be put onto the system. And then we can attribute different things that they may interact with as well. So with one instance, when we was working with Age UK, they delivered quite a lot of one-to-one via their Good Neighbour, but it was their volunteers that was doing that with the service users. So what we could do is we could add a link between the volunteer and the service user as well as the staff to sort of really get that important information about how many volunteers have provided X amount of one-to-ones, what does that look like, who are they talking to, and so we've been able to do quite a lot of interesting things like that. But yeah, it's a very simple thing for us to do.
Brilliant, thank you.
Thanks, James. Gemma, you had a question?
I was just thinking it pulls an awful lot of data. It's fantastic. I actually wondered how time consuming it is to fill in the level of detail that we've got. We'd be thinking about working across several different systems. So with the social prescribers, hopefully they'll be using EMIS to communicate with GPs, the GP surgeries they're working in, and also we've got our own database that we use. So it's kind of, yeah, how time consuming is it to use alongside of the systems, I suppose, is my question.
It's sort of it's quite interesting in a way, because what we sort of do is when we sort of look at bringing sort of multiple services together that have been on maybe different systems altogether and different things like that, we can sort of look at how we can streamline that as well, because we do that quite a lot with removing some of the sort of obstacles that people are seeing and moving that sort of really arduous repeating data inputting areas as well, like you've probably seen with the referral section, for example, and where you can just transfer a lot of things as well. So it really does depend. We can cut a lot of the sort of filling in as well, but we can also do different things. So we can add, for a couple of organisations, we've just done a lot of mandatory fields. So the things that you really need, you fill in, but then you've got the option to fill in the others as well. So it really does depend on your forms, really. But in terms of the process, we do, on probably about 80 to 90% of the organisations we work with, we cut down, we streamline their process and make it quicker, just because of how we just see the progression of moving through the system. But it is a lot quicker, because you can, there's quite a few little functions you can do as well. You can tab through things. We do a lot of pick list options as well, which make things a lot quicker, so you're not having to type them out. But there's a lot of time saving things that we can build into the system.
What I'd say as well is what James has shown you is kind of what different things that the system can do. So that wouldn't mean that you're filling in all of that information that James has shown you. So you'd have to just really start to look at what it is that you really need to capture and what don't you need to capture, and you just pick certain bits and build the system in terms of what you need. So you wouldn't be filling in kind of all of that. I mean, our social prescribers don't all have access to IMIS. Some GPs allow us access to IMIS, but it's quite limited in terms of the only stuff really GPs want us to fill in is just when they're referred, when they've been exited. But the IMIS for us doesn't capture a lot of the outcome data that we have to do. So our system kind of, it captures everything that we need to do, which IMIS doesn't. Unfortunately, in some of our practices, we have to literally be in the surgery just to enter a bit of information that the GP wants us to keep brief, but we use our PSIAMS system just to do all of our reports in terms of all of the outcome data and stuff as well, which the IMIS doesn't do. So that can be a bit, oh gosh, we've got to do this in IMIS, but it's only small data that we have to put in IMIS. The majority of it goes into PSIAMS, but I don't think the team actually find it. Once you get used to it and you just input your data and keep on top of it, it's easy to use.
I mean, I can.
Sorry, can I just ask another question? So, I mean, obviously, James, you say somebody commissioned you to come in and say, yes, we want PSIAMS. You go in and spend an initial amount of time with them, setting up, streamlining, training, and what have you. Is that all included in that cost of, what was it, £5,000 to £7,000, depending on the size of organisation, or is there a separate cost?
No, that's all part of that cost. So we put that in as our sort of build and production cost. So then that would include the meetings, what we call mapping processes as well. So where we get an understanding about what you do and what your sort of aspirations are for a system. And then from there, the subsequent meetings following that, where we can sort of pull together a bit of, this is what we think that you want. So then we can have those, but all of that is all put together in one cost. Yeah. The only thing that will be separate will be the Salesforce licenses from our cost, because we put our first year support within that original cost, and then obviously year 2 it will be support separate and licenses separate to Salesforce.
And how many users have you got? How many organisations have you got using the system at the moment?
In the Dudley system, I think it's about. I think it's close to 20 organisations, but we work with about 40. No, it's not. It's about 35 in total. It's over 400 users, so it's across multiple systems.
I think what's really useful to point out as well is how the ethos behind PSIAMS, with it being a community interest company, you know, a lot of CRM systems out there can come back to you 6 months, 12 months later with, oh, this is going to cost you now, and oh, this is going to cost you now. Whereas with PSIAMS, you don't get that because it's built by the voluntary sector for the voluntary sector. So that's really key. Yeah.
From the I've said this at this morning's session with the commissioners, was I think it's just about being really clear if it's something that you wanted to kind of progress and look at going forward, is what's the vision really for the area. So what's the purpose of having this system? So is it, I know that some of the commissioners were talking about wanting to have kind of more collaboration across voluntary organisations, and whether that's piloted with a just sort of themed set of groups around mental health to kind of sort of almost pilot it. But I think they seem to be quite keen about having a consistent way across organisations to gather outcome data to see what's the bigger impact a collective group of voluntary organisations are making, but also making it easier for the people that are being supported. So rather than individuals going to each individual organisation and having kind of separate, it's about organisations joining up through the system to make sure it is sort of holistic. We even talked about, whether one organisation takes the lead for that person and then acts as a bit of a care coordinator for that person and brings in the other organisations around that person, so it's avoiding that kind of duplication, and it's easier then for joint commissioning kind of reporting. So, or I think that's the vision of the commissioners in your area. I said, the other option is whether it's again just a system for your own individual organisations to help you with your data management. It can be both of those things, but I think locally it's about being clear about what that's. Is it about collaboration across the sector and the system enables that, or is it about better data management as individual organisations? Because then it's about a culture change, isn't it, about using the same sort of paperwork, the same kind of outcome tools, so you've got that kind of more strategic overview data.
We're very much at the start of this, and from this morning they were very impressed. The local authority and the CCG, and there was a lot of interest, but it is the start of the conversation, and there just need to be further conversations and agreements really about that vision, and what they want the system to demonstrate, and kind of align it with the local priorities that we might have. So yeah, get my magic wand out. The vision for myself, or for the area, would very much be to have some money available to build as many systems as possible for the voluntary sector. So we work together to identify what would be a kind of core assessment that would demonstrate as many things to align with those local priorities that the authorities wish to be demonstrated, and then within that core assessment, each organisation can add other sections to it that they might need to demonstrate to other funders that they might have, such as the Community Foundation Trust or the National Lottery or whoever that might be. So yeah.
I guess probably your one of the great outcomes would be that it's jointly commissioned through the CCG and the local authority if they want that common core assessment through a number of organisations, that's paid for by them, and then the voluntary sector groups, you just pay for kind of your day-to-day, your yearly licensing fees for your staff to kind of access and use the system would be an ideal solution, I guess, so the cost isn't put on the voluntary organisations directly for the build itself.
Be great to get Shropshire and Telford local authority together to.
I think from my point of view, and obviously I haven't got a vested interest in this. I'm not the one that's going to have to sit there and do data entry and whatever. But I've used Salesforce previously, and it is a robust, very adaptable system. I think the sorriness of all of this is that you haven't got anybody from Shropshire Council at this early stage, which actually just shows the issues that we've got in the county, which I think it's crucial to have them on board, because it's almost a case of what's not to love from what I've seen today. I see that irrespective of what the CCG and the local authorities want, this would, subject to cost obviously, which could be prohibitive for some organisations, it does everything that anybody should be doing. So I would question why the local authorities and the CCG wouldn't possibly want something like this. But I think it's crucial to take it on to the next stage. You've got to get in front of Shropshire Council somehow, some way.
So I mean, I've recorded this session to send out to the other voluntary sector organisations. I've recorded the morning session, which I'll forward on to all those attendees. And Dean, I'm happy to share that over to yourself if you want any contacts over in Shropshire to have sight of that morning session. That might be useful. I know you've sent me some contacts previously, which I'll send it out to as well. But hopefully, like I say, it's just the start of the conversation really, and it'd be ideal to, yeah, well, get that magic wand out. So are there any other questions from anyone? Or are we,
not a question for me, Toby, but just something else to add was, Dean, you were mentioning at the beginning that there was something you just said around a directory of services, so you can really sort of also for organisations to use to make referrals on. Within PSIAMS for our area, we've got that directory of voluntary sector groups built in, so we can, if you kind of like, oh, is there a group around so, because obviously individual staff, it's hard to keep all of that information in your head, so that information is in our system for Dudley, which could be replicated for the voluntary sector in Telford and Shropshire as well.
Dudley, I grew up in the Black Country, so but Shropshire is enormous, as you can imagine, and so you're right that, you know, even as I say, through my last 6 months, I'm talking to people in Oswestry who've no idea about something that's going on in Telford, and that's been able to help them out just to do with some, you know, rehab programs and things like that. So I think that's crucial. And I was interested to hear Deb saying about the managing volunteers as well, which I was actually talking to the foundation about earlier in the week, that it's quite a big problem in Shropshire, how the whole volunteer issue and volunteering is managed or controlled, if that's the right word. It's not, I think, is the fundamental issue. So there's a wider aspect to it as well.
Super. Well, unless there is any other questions from anybody, I think I'll bring things to a close and thank everybody for attending. Thank you especially to Kate and James and Dean for your input as well. As I said, I'll be sending out a recording of this to all attendees, yeah, we'll have further conversations, I hope. Okay.
Nice to see you all.
Nice to see you all. Thank you very much. Have a good
Thank
weekend.
you very much. Thanks very much. Very informative.
Take care.
Thank you.
Have a nice weekend all.
Bye.
Take care. Bye.
Bye. Bye. Bye.